Hello, Senate Majority Leader David Hogue, House Majority Leader Mike LaFleur, Speaker of the House Robin Wise, and Senate President Michelle Strindon, and members of the committee. My name is Jacob Knutsvik Partita from Bismarck, North Dakota, and I am here in favor of Bill S-3762, also known as the Prior Authorization Relief Act, as well as H.R. 4313, or the Hospital Inpatient Services Modernization Act. As a future nurse practitioner serving our communities, I strongly support both S-3762 and H.R. 4313. Together, these pieces of legislation address two critical interconnected challenges in healthcare: excessive administrative burden and limited access to timely, high-quality care in rural America. In states like North Dakota, patients often face unique and significant barriers to care: geographic burden requiring long travel distances, workforce shortages, and limited hospital capacity in an expanding population. Prior authorization requirements only compound these challenges by delaying essential diagnostics, treatments, and referrals. These delays are not just administrative inconveniences, but lead to worsening patient outcomes, avoidable hospitalizations, and increased costs for both patients and the healthcare system. Innovative care deliveries models such as hospitals at home, supported by the H.R. 4313, offer a transformative solution for rural healthcare. This model allows eligible patients to receive acute hospital-level care in their homes through a combination of in-person visits, remote monitoring, and telehealth services, a growing concept allowing for increased access to healthcare. Extending these programs through 2030 provides the stability needed for health systems to invest in and expand this high-quality, patient-centered model. For rural patients, hospital at home is more than a convenience, it is a lifeline. It reduces the need for long-distance travel, decreases exposure to hospital-acquired complication, and helps preserve limited inpatient bed capacity for those who need it most. For my entire career in healthcare, I have been at the bedside in North Dakota, facing the challenges of finding specialized care for patients and often having to transport them many miles from their homes and families. In my previous position as a flight nurse, I have also seen how our rural healthcare facilities struggle to find placement for patients requiring higher levels of care. At the same time, streamlining prior authorization processes under the S-3762 ensures that care, whether delivered in the home or the hospital, occurs without unnecessary delays. Bismarck specifically is unique in its geography, serving as a hub for high-quality tertiary care for patients across the Dakotas and eastern Montana. Ensuring that we increase our capacity to continue helping those in need is of paramount importance as populations and healthcare costs increase. Rural clinics and hospitals operate with limited staff and resources, making administrative inefficiencies especially burdensome. Time spent navigating prior authorizations or redundant documentation is time taken away from the patient. By reducing these burdens and supporting innovative care models, these bills empower nurse practitioners and other providers to practice at the top of their training and deliver timely, evidence-based care. I urge you all to support both S-3762 and H.R. 4313. These policies represent a meaningful step toward reducing administrative burden, expanding access to care, and strengthening healthcare delivery in rural communities. Together, they will improve patient outcomes, support frontline providers, and ensure that where a patient lives does not determine the quality of timeliness or care they receive. Thank you all for your time and for allowing me to provide insight into these bills that can make North Dakota healthcare better for all. I will be happy to answer any questions you may have. Thank you.